Sri Nephew Rio, the Honorable Chief Minister of Nagaland, Sri S. Pangyu Phom, the Honorable Minister of Health and Family Welfare, Government of Nagaland, Sri Amardeep Bhatia, the Principal Secretary to the Chief Minister and Development Commissioner, Sri Y.K. Seema, Commissioner and Secretary, Health and Family Welfare Department, Government of Nagaland, and Dr. Temjengt Sungla, Principal Director, Health and Family Welfare, and all the dignitaries on the stage, and all the audience here physically, as well as attending over YouTube and Zoom globally. I'd like to welcome you for this event. It is indeed a delight to be in this beautiful state of Nagaland. Reminds me of California, where I used to live many years ago. It's a lovely state. I've spent a couple of days here. I was given a very warm welcome by the government of Nagaland. When I landed at Dimapur, they draped me in a beautiful Naga shawl, which is wonderful. It was an honor to be draped with that. And today I thank the Chief Minister for draping me with another shawl from the Naga tribes. At the outset, I must say that it has been a delight to work with the government of Nagaland. The pace at which we have gone is incredible. The first time, we are working in 8 states. This is the first state where we have launched 10-bed ICUs in every district hospital within 1 year, in less than 1 year. Please, a round of applause to the government as well as the 10-bed ICU folks for having finished the project in less than 1 year. Not only have all the hospitals have where these ICUs have been deployed, but the TeleICU hub at the NHAK hospital that you would have seen earlier that the Chief Minister inaugurated was also launched in less than 1 year. So it's been wonderful. Well, I'll tell you a little bit about how this project started. I was actually working from home in my hometown of Mysore, in my mother's house, and I got a call one day. This was during the COVID Delta wave, which was sweeping the country. Oxygen was a problem. There were a lot of issues. And I got a call from a friend who said, "Srikanth, I need a ventilator for my mother who's old. She will die if she doesn't get a ventilator bed." This was from Bangalore. And I spent the next 2 hours trying to find a ventilator, and thankfully we did. Next day again a call. Now it was a 26-year-old boy who SpO2 level was 76. He was dying. Again we found ventilators. This went on for almost a week to 10 days. Then I realized that this is unprecedented in the country. And at the same time, Dr. Sudarshan, who runs the Karuna Trust, who's a partner in this enterprise, he told me that it is not just in urban areas. It is not just Bangalore and Delhi and Mumbai and so on, but it's also in rural areas, and it is spreading fast. And unfortunately, in these smaller areas, in the smaller towns and villages, they don't have ICUs. So a lot of deaths are happening because of that. So while I was sitting there, I said, we have to work on this. And though I didn't know much about healthcare, I've worked in healthcare in the United States at Healthy on WebMD, whereas in India I have not. But so we started this project. So there are 5 pillars to this project. The first is the medical equipment. Basically, we create a 10-bed ICU in an existing government hospital, in an existing space, which the government provides after we sign an MOU with the state government. We take up all the districts, at least 1 hospital in every district. What we soon realized was, even after we launched 40 hospitals in Telangana, 36 in Andhra Pradesh, and so on, we realized that in spite of creating the ICUs, the medical staff, the specialists are not there in those smaller areas, in the rural areas. So that's a problem. And so hence we created the second pillar, which is the TeleICU that you saw the CM launch today, where a medical hospital such as NHAK can provide its specialists to help those rural patients through an online connected cloud-based system. Okay, this is something we have built. It's a really nice system. I'll explain a little bit more about it. So we had to build a robust platform, which is pillar number 3, the care healthcare platform, a technology platform in order to make things scale elegantly and ensure that all the hospitals get the kind of EMR, electronic medical record, and the TeleICU facilities and the pandemic management facilities. So we built that. I'll share more about that. Fourth, of course, is training modules. I'll talk about the kind of robust training modules we have launched. And lastly, the community participation, so that everybody gets access to these assets. The community takes control and manages it with the help of the administration. So today, as you see, every district of Nagaland is covered. Well, I was informed while we were there that 4 new districts have been formed. We will endeavor to launch in those 4 districts as well. In fact, I'm requesting the HDFC Bank to fund those 4 districts as well, because the request has come today, so make sure that we can do that as well. But as you can see, every district currently, as we know it, has been launched with 10-bed ICUs, including the far-flung districts, Mon, Noklak, Kifre, and so on. And we'll look at how they work out there. And we'll talk a little bit about the donors who have been extremely generous in making this happen as well. So the first pillar is basically equipment to set up a 10-bed ICU. This is the state-of-the-art equipment. This is not L1 equipment that we bought. The ventilators are imported from Switzerland because we needed AI ventilators so that in the remote areas, if you don't have a specialist, it will still, the AI ventilator can auto-wean the patient using the lung pressure and the CO2 levels. So we have brought in this, of course we have to pay customs duty and so on, but still we ensure that it is top of the line. And in fact, we are hearing from your doctors as well as doctors everywhere else that this is an excellent piece of equipment. In fact, Dr. Rakesh, who is here from Imphal, was telling us last night at dinner, that you just need 3 buttons to press before the ventilator starts. In many other places, it's very complex to initiate these. 5 paramonitors, X-ray machines, ECG machines, ABG auto analyzers from Siemens in Germany. All of these are state-of-the-art equipment. About 26 items are given to every hospital, right? We fund all of this. The capital costs are funded. Not just the equipment. The equipment, the installation of the equipment at your locations, the training of your doctors and nurses at your locations, and a 3-year warranty. Usually you get a 1-year warranty. We have negotiated a 3-year warranty so that the government doesn't have to immediately start funding it. After 3 years, you need to fund the maintenance, the AMC contracts and so on. So as you can see today, from Noklak to Woka to Dimapur, Kohima, Tuensang, Fek, all of these hospitals are ready. These are photographs from those hospitals coming from about a week ago or so. Kifre, Mon, Dimapur, Mokchong, Zuneboto, and Longleng. All of them are ready. In fact, today, you're going to see a simultaneous launch. When the Chief Minister launches, you're going to see on the screen all the hospitals going live simultaneously in a few minutes. Second pillar, the TeleICU. I talked a little bit about it. What we have done is we have connected the NHAK TeleICU hub that the CM just launched to the various district hospitals that are there across the state. When we say connected, it is through an internet connectivity. 6 of them have high-speed fiber broadband internet. Other 6, we request the administration to also improve those in order to get the kind of video feeds and so on going, which I will talk about. So of course, we were just now at the Naga Hospital Authority Kohima, where we launched the TeleICU hub. As you would have seen on the video, this is the TeleICU hub room where the specialists can sit and help the patients in all your far-flung hospitals. It's one of the, Woka is one of the hospitals, a photograph of that. I just want to talk a little bit about, many of you are probably, from a clinical background, there's lots of nurses and doctors here. We provide 4 facilities. One is a doctor-to-doctor video communication between, the specialist and the local doctor in the district hospital, which is on the left. Below, we have also installed these high-res cameras in the far-flung hospitals, in your district hospitals, so that the specialist at NHAK can zoom in on the patient and take a look. You might have seen that in the demonstration we did live, right? These are powerful cameras, and you don't have to go figure out where is the patient. Automatically, when you put the patient name, the camera knows how to. Can someone there please stop talking? It's disturbing the audience. Yeah, thank you. So the cameras are high-res cameras that will zoom right into the patient. You can see right up to the pupil. On the right, you see the electronic medical record itself of the patient, including all details of consultations, treatments, and so on, as well as you can see the various views from the high-res camera. So the magic of this, a lot of people ask, how does this work? On the right side is one of the district hospitals. On the left side is the TeleICU hub. And it's connected through a cloud software. And Google has been kind enough to offer their cloud services for free for a year to the state of Nagaland. So it's hosted on the Google Cloud right now. And whether it is the 5-para monitor, high-resolution camera, the video communication, or the electronic medical record, from the district hospital, it is conveyed to the TeleICU hub. So the doctor feels as though he's in front of the patient. Every detail is there electronically, right? So we can go to the TeleICU hub. We showed this to the Chief Minister. You can click on, let's say, Tuen Sang, and you see the patients there. And once you click one of the patients you want to consult with, you see the full details, the waveforms, the consultations, all of that. And you can use the high-res camera to zoom in on the patient, whether it's a bed view, the face view, or even the 5-para monitor view. These are all completely done through the software. The CARE platform manages all this. In fact, this is one of the network operation centers. We have built dashboards to manage the pandemic effectively. It has real-time analytics to monitor beds, ICUs, ventilators, oxygen monitoring, which was a huge problem last year. We have GIS monitoring for visualizations of capacity on a map of Nagaland, facility management, inventory control, and so on, and also the daily dashboards. In fact, one of the chief ministers asked us to put this dashboard in his own office because they wanted to track exactly how many consultations, how it is helping the citizens. And of course, all of this is free and open source. There is no proprietary software here. Even if the state of Nagaland wants to further build on top of this, we completely do that. And by the way, the United Nations has recognized CARE as the 50th digital public good in the world. So this was sort of a high honor coming from the United Nations on the software that is built by the 10BedICU team. The fourth pillar is the training. The medical equipment training is done by the vendors. They come here to your hospitals and train the doctors and nurses. The software, CARE software training is provided by the 10BedICU team. Aparna and her team do this. The TeleICU module training. How do you communicate with a patient and a doctor 100 kilometers away? It's quite different from handling a patient who's right next to you in the bed. What is that protocol? How do you make that happen? So that is on the TeleICU module training. The ICU clinical course, we have a basic course on ICU clinical. We also have an advanced course by the American Heart Association, and also training on ventilation and respiratory support, especially intubation and so on, which might be new to some of the nurses. So here are some photographs of the various trainings that have been happening. Already in Nagaland, we have started the various training. Now, a little bit about the donors who have contributed to Nagaland. Vinod Khosla, a bit about him, context of this. When we started running out of oxygen in Delhi, we were seeing this in the news all the time. He tweeted saying, I'm willing to help hospitals that have a problem in India. That tweet got retweeted 20,000 times, okay? Lot of people said, I will support this. Lots of company heads started putting money behind this. And in India, there's a lot of people who started asking him, I need help. We're running out of oxygen, we're running out of ventilator beds and so on. And of course, that sort of channeled into this project, the 10BedICU project, and we started taking up in various states. Today we are in 8 states. We are in 200 hospitals, 210 bed ICUs, and he has in fact donated money for 100 hospitals. He promised this when we launched in Telangana, and we actually reserved much of it for Northeast. And today, out of the 12 district hospitals, 11 of them are funded by Vinod Khosla, as well as the TeleICU hub. A round of applause for our generous donor, Mr. Vinod Khosla. The HDFC Bank, I was earlier on the board of the HDFC Bank, and Shashi Jagdishan, the CEO, promised me that he is going to support the project fully. And today we have the HDFC Bank folks here. They have donated money for the 10BedICU in Dimapur, and I'm requesting them to help us in the 4 more districts that were brought up. So thank you very much, HDFC Bank. The 2 others, of course, the Google Cloud I mentioned, they have given us, the state of Nagaland, free access to Google Cloud, and the instance belongs to the state, not to the 10BedICU. The data and the records, all that belongs to the state, the health department, and Google has done that, as well as Hamilton Medical, the ventilator manufacturer. For every 2 ventilators we are buying, they're giving us 1 free, so I want to thank them as well. To wrap up, this is a coalition of partners. While the Delta wave swept and a lot of deaths were happening, we had to come together very quickly. So the e-Governments Foundation partnered with Karuna Trust, and we have the Secretary of Karuna Trust here, Venkat, and Dr. Sudarshan couldn't make it, but it's wonderful. And they are our local partner here as well. They have a good presence. And the Nagaland Gandhi Ashram has also helped us in implementing in, I think, 8 of the districts. Thank you so much. Of course, the funding has been for all the various states, Khosla Family Foundation and Parivartan, HDFC Parivartan, Give India, Crypto Relief Fund, and I myself as well. The medical technology partners we mentioned, Google, Hamilton, BPL is who has been providing all the equipment, as well as Dell. All the computer equipment comes from Dell. So all of them are state-of-the-art, high-quality equipment from the best of breed. The project management unit, I just want to take a minute. Sri Abhijit Sinha, the Home Commissioner, Sri Y.K. Seema, the Commissioner of Health and Secretary, Health and Family Welfare, Srimati Ansangla Imti, the Secretary of Health and Family Welfare, Dr. Temjeng Sungla, the Principal Director of Health and Family Welfare, Dr. Ritu Toor, Mission Director, Dr. Chumbabati Chang, the Joint Secretary. They've all helped us to make this project happen. And of course, our own team has also been part of the PMU that has made this happen in less than 1 year. The 10BedICU team itself is a fantastic team. It's quite a small team, very professional. Mr. Vinod Khosla has been a huge donor as well as a mentor for the project. And you have Dr. Sudarshan from Karuna Trust. You see all of them here at different levels who have worked really hard from around, Kerala, in Karnataka, in Northeast. And I want to single out one person, Bisoya Leutenbaum, who's here on stage today. She is from the Northeast. She is the Northeast coordinator of the project, and her team is all being camped here in Nagaland, working day and night on the project. And I want to say today, the fantastic work she's done in Northeast, she is now promoted as the coordinator for all of the country for 10BedICU projects. A round of applause for Bisoya.
Thank you.